Good morning, everyone, and welcome back to UWorld's live NCLEX review session. My name is Nicole here with another question drill set. If you are new here and don't know how a question drill set works, well, welcome in. I'm so glad to have you. So glad to be learning with you in the next 30 minutes as we go over skin-related NCLEX style questions. So I will pull up a question right up above me, give you about 30 seconds to review the question, review the answers, and drop what you think down in the chat. I like to conversate with you guys in the chat, whether you're on TikTok, YouTube, Instagram. We like to talk in the chat and figure out why the right answers are right and the wrong answers are wrong. And then I give you some pointers on how we can go about these questions, whether we're looking for keywords in the question or how it's phrased or how the answer choices are phrased. Just all pointers and tips to get easier and get better at answering these NCLEX style questions so you can pass your NCLEX on the very first time. So without further ado, let's get started. Question number 1. The nurse is observing a staff member caring for a client who is at risk for a pressure injury. The nurse should intervene if the staff member is observed doing what? Option 1, placing foam protectors on the client's heels. Option 2, using a draw sheet to reposition the client in bed. Option 3, maintaining the head of the bed at 60 degrees. Or option 4, applying a moisturizer to the client's skin after bathing. Drop what you think down in the chat and let's get the chat going. Congratulations to Douglas Amosa, who said that they just passed. Congratulations to you. Welcome to the RN world. Someone also said, I still watch even though I passed the NCLEX. So glad to hear. Our review sessions are always good to just continue to watch so you can stay in the know and stay in the practice of critical thinking and maybe even learning some other disease processes or different things that you might not be used to or working with in your specific unit. So always come back and watch us. We love the support. Also, shout out to Mount Sinai. I know I shouted them out last week, but again, shout out to you guys. You guys use our Book a Klexpert tab on uworldnursing.com, which gave them a private session, a private lecture with us that we held with their school. So if you guys want to get your school to have a private lecture with us, UWorld Nurses and us Klexperts, go to uworldnursing.com and click the link that says Book a Klexpert, and then we will arrange that for you. I would love to come speak at you guys' school. So don't be afraid. Get a whole bunch of your nursing student cohort team together and then book the Klexpert. So let's move on to the correct answer. Option 3, maintaining the head of the client's bed at 60 degrees. So going back to the question, the nurse should intervene. So that is our main word in the question. Intervene meaning that we are looking for an incorrect option or incorrect intervention and something that we wouldn't want to do. So we wouldn't want to maintain the head of the client's bed at 60 degrees because that increases the chance for a pressure injury. The sweet spot for decreasing the risk, decreasing the risk for a pressure injury is between that 30 to 45 degree angle. So it's not too much creating too much pressure on the sacrum and the coccyx if they're at a 90 degree angle, but also not as bad as laying flat on the bed. So you have multiple bony prominences up against the bed. So that 30 to 45 degree angle is the perfect sweet spot. 60 degrees is a little too high. Options 1, 2, and 4 are correct teaching points with risk factors for pressure injuries. So placing the foam protectors on the client's heels. Again, this creates a supportive barrier between the client's heels and the bed. Option 2, using a draw sheet to reposition the client in bed. This is okay, but you also want to make sure that that draw sheet underneath them doesn't have any wrinkles. So once you do reposition them and pull them up in the bed or whatever, that you make sure that is pulled taut and that there's no wrinkles underneath them. And then option 4, applying a moisturizer to the client's skin after bathing. This keeps their skin hydrated and reduces the risk of skin wounds and all that stuff. So correct answer would be option 3 because we're intervening with that one. Next question. The nurse has attended a staff education program about contagious skin conditions. Which of the following statements by the nurse would indicate a correct understanding of the program? Select all that apply. Is it option 1, impetigo is transmitted through inhalation of infectious droplets? excuse me. Option 2, herpes simplex virus can be cured by treatment with acyclovir. Option 3, clients with atopic dermatitis require contact precautions. Option 4, Tinea corporeus could be spread from animals to humans. Or option 5, pediculosis capitis typically occurs near the scalp. You guys know that I am not the best with my pronunciation of a lot of things, especially when we're getting into nitty-gritty disease processes like these ones. So let me know what you guys think in the chat and maybe how you pronounce some of these words. Do you say we were actually talking about this in the office the other day. Impetigo, impetigo, impetigo. How do you say impetigo? Anyways, drop your answers down in the chat. Also, let me know what you guys think. Are there any recent NCLEX passers, or some of you guys may have recently scheduled for your NCLEX, or if you're waiting for your ATT, I would love to give you guys a shout out, whether it's good luck, congratulations, or keep on keeping strong with the patience for the ATT. I would love to give you a shout out. So let me know in the chat if you're getting prepared for your NCLEX. Yes, someone said there's more than one right answers, but they're stuck on one. Sakira takes theirs on Monday. Good luck to you. You're going to do great. Get a good night's rest, but you're tuning in. You're getting some last minute studying in. You're going to do awesome. Fanita just passed. Congratulations to you. Welcome to the RN world. K. Marie takes theirs on Monday. So scared. Don't be scared. You got this. You are going to do great. Someone is waiting for the ATT. 2 people are waiting for the ATT. 3 people are waiting for the ATT. It's okay. Patience is a virtue. But you'll get your ATT and then you'll get to your NCLEX very, very soon. So you guys got this. Okay, correct answers for this one is options 4 and 5. So which of the following statements by the nurse would indicate a correct understanding of the program? So that means we're going back to looking for correct statements. So with select all that apply, it's good to use, or it's easier if you use each answer choice as a true or false statement. So options 4 and 5 would be the only true statements that would indicate a correct understanding. So option 4, Tinea corpus, which is ringworm. So those can spread from animals to humans. It's kind of like a fungal spore. So sometimes it gets really deep into animal skin, and then you're cuddling up against your dog or your cat, and then it can come to you. So yes, it is able to be spread from animals to humans. That is ringworm. And then option 5, the pediculosis capitis, or the harder word for lice, that does typically occur near the scalp, and they get infested, whether it's the actual larvae themselves or with the eggs, but it happens near the scalp and it can get really infested in your hair. So that is a correct teaching point. Options 1, 2, and 3 are incorrect teaching points. Impetigo, impetigo, impetigo is transmitted through inhalation or infectious droplets. This is incorrect. This would be transmitted through actual touch. So direct contact, or direct contact with the drainage, whether it got on like the clothes, but it's not through inhalation. Option 2, herpes simplex virus can be cured by treatment with acyclovir. Herpes simplex virus is not curable. It's just manageable with acyclovir, and it helps treat the symptoms, but there's no cure for herpes simplex. And then option 3, clients with atopic dermatitis require contact precautions. This is incorrect. This does not need contact precautions or any precautions. This is just dryness of the scalp. So no, does not need contact precautions, but you guys did great. Next question. The nurse is assessing a client with, again, impetigo, impetigo, impetigo. It would require immediate follow-up if the client has what? Option 1, pruritus. Option 2, periorbital edema. Option 3, honey-crusted exudate. Or option 4, erythema surrounding the vesicles. Let me know what you guys think in the chat. Oh, we have some more people that just passed. Issa Colkello just passed their NCLEX. Congratulations to you guys. Anyone else? No, it's totally fine. But congratulations and good luck to you guys that are about to take their test in the next coming weeks. If not, we have great review sessions for you guys to be tuning into. But also, it is conference season. And specifically right now at this second, we have Nurse Jasmine and Nurse Samantha down in Orlando, Florida for the Florida Nursing Student Association Conference. So if you're around Florida or if you're tuning in maybe during a lunch break or something, make sure you go by our booth at the conference and say hi to those guys. Then we have, next week we have NSNA in Columbus, Ohio. Then the next week we'll be in California, San Diego, California for the CNSNA or CNSA. And then we'll also be at SNAP in Harrisburg, Pennsylvania. So multiple weeks for you to come by our booth, come say hi, come meet us in person. We would love to chat with you guys. Don't be afraid. We're totally nice. We don't bite that hard. Just kidding. It's Halloween, but I won't bite. I won't bite. They said, where in Columbus, Ohio? I'm not exactly sure, but I just follow the crowd. But if you go to NSNA website, nsna.com, you can find the exact location and register and be a part of the conference. Okay, correct answer for this one is option 2, periorbital edema. So, requiring immediate follow-up, meaning if we don't intervene soon, this can turn into some life-threatening complications. So we look for expected findings versus complications with a question like this. So options 1, 3, and 4 are all expected findings with impetigo. This is a common bacterial infection that happens usually around the face. It's caused by the Staphylococcus aureus bacteria, and it causes swelling and inflammation. But if that swelling and inflammation gets so bad that it becomes periorbital edema, that means it could be becoming more systemic and becoming more infectious in your blood. And that would be a very big complication that could spread and cause even more complications down the road. So we would want to intervene and do some interventions immediately for this periorbital edema so we can stop the spread of the infection, because it is very, very contagious and can spread very easily. But options 1, 3, and 4 are all expected findings of impetigo. So you guys did great with that. Option 2 all across the board. Question number 4, the nurse is planning care for a client with cellulitis of the right foot. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Option 1, put on an N95 respirator mask before entering the client's room. Option 2, maintain the client's affected extremity in a dependent position. Option 3, mark and date the area of inflammation. Option 4, apply warm compress to the affected area. Or option 5, encourage the client to ambulate frequently. Let me know in the chat what you guys think for this one. How do we treat or plan care for someone with cellulitis? Also, we're halfway through, so I can ask my favorite question to ask every week. Now that a good bunch of you guys are on and getting chatty in the chat, where are you guys tuning in from? I love to see how far UWorld reaches in the world, whether you're domestic and just waking up, maybe, if you're late riser, or eating lunch, or if you're international and you're ending your day. Let me know where you guys are tuning in from, and I'll give you a shout out. We have Ghana, Massachusetts, Kenya, Century, Florida, San Antonio, Texas, Florida, Tampa. A lot of Florida people today. Minnesota, Ohio, Florida again, Kenya, Miami, on lunch in Clinical. Hello from Clinical. Minneapolis, Ohio, Virginia, Charlotte, Tennessee, Pakistan, Kenya, Ohio, Ontario, Nebraska, New York, Palm Springs, Arkansas. In all caps, Bay Area, Nigeria, Bermuda, Dallas, Honduras, Philippines, Sierra Leone. Lots of people from all over. Love to see it. Thank you guys so much for tuning in. We really appreciate it. We love when you guys are interactive in the chat and talking to us and viewing from all over the world. It keeps us going and keeps us getting you the product and the question drills that you guys need. So keep tuning in. Always Subscribe to our channel if you can. Like, comment, and subscribe, whatever the YouTubers say. But we really, really appreciate you guys. So correct answer for this one would be options 3 and 4. When planning care for someone with cellulitis, this is inflammation of the subcutaneous tissue. So this can happen pretty much anywhere that there is skin and subcutaneous tissue. It can happen on your arms, the legs, but we need to try to mediate the infection by keeping it in that one area. Give the antibiotics, do all the treatment so it doesn't spread. We mark and date the area of inflammation so that we can track if it does start spreading. So it would be a really, really red area, erythemic part on your body. And so you mark it with usually a Sharpie with the date and time, and then you watch to make sure it doesn't spread any further. Otherwise, we might need to change our treatment plan to do more in-depth treatment. And then option 4, apply a warm compress to the affected area. This would be good because applying warm compress can help reduce the swelling that might be happening. It also increases that blood circulation. So if they're getting IV antibiotics, it's getting that antibiotic blood to that area. And then it also can help relieve pain. Options 1, 2, and 5 are not correct teaching points for cellulitis. Option 1, put an N95 respirator mask before entering the client's room. This is not an airborne infection, so it does not need that N95. Option 2, maintain the client's affected extremity in a dependent position. That means like hanging down. You actually want to have it elevated, so propped up on some pillows would be the best position to be in. And then option 5, encourage the client to ambulate frequently. This is the one time that we promote rest. So have them lay down, sit on the couch with the legs propped up or something, but actually rest would be the better choice in this case. But you guys did great. Next question. The nurse is teaching the parents of school-age children about treatment of pediculosis capitatis. Again, with my words. Head lice. At least they put it in parentheses this time. Head lice. Which of the following information should the nurse include? Select all that apply. Option 1, wash your child's bed linens in cold water. Option 2, keep your child's fingernails trimmed short. Option 3, remove nits from your child's head using a fine-tooth comb. Option 4, treat all your household pets with pediculicide. Or option 5, seal non-washable items in a plastic bag for 10 to 14 days. Let me know what you guys think in the chat. It is the select all that apply, so more than one correct answer. Let's see what you guys are thinking in the chat. I see lots of 2s, 3s, and 5s. Good job, guys. Someone says 1, 2, 3, 4, and 5. I will give you a pointer with select all that apply. It's usually never, ever, ever all the correct answer. And it's usually always more than one correct answer with a select all that apply. So that's the criteria. It needs to be more than one, but not all of them. So maybe you want to rethink some of your answer choice. We're looking for correct statements when treating head lice. So not all of these statements are true statements. Now I'm seeing 2 4s and 5s, 2 3s and 5s, 2 4 5, 3 4 5. We're getting a good mixture of things. Let's move on to the answer. Then we can maybe get some more tid points on how to answer these select all that apply questions. One of the tricks that we use here at UWorld is to read each answer choice like a true or false type of answer. So option 1, wash your child's bed linens in cold water. This would be a false statement. For treating head lice or something like head lice, we would actually want to wash the clothes or anything that is washable in very, very, very hot water, because that will kill the lice or kill the larva that has infested the clothing or the garments. Option 2, keep your child's fingernails trimmed short. This would be a true statement. You want to keep the nails short so it doesn't cause any abrasions when they do scratch, because it can be kind of itchy. But then you also don't want them to transfer that lice to another area by scratching if their fingernails are long. Option 3, remove nits from your child's head using a fine-tooth comb. This is correct statement. If you can get rid of all the lice as much as you can manually, that would be the best. Those fine-tooth comb are very, very, very fine if it comes in like the knit kit that I see. But if you can remove it manually, that would be a good choice to do. Option 4, treat all your household pets with pediculicide. This is a false statement. This pediculicide is actually only used on humans. Human lice, although animals can get lice, they get a different type of lice. So this pediculicide is only used for human type of lice, human lice. So it would not be able to be used on household pets, and it could be actually very harmful for household pets. So do not do that. And then option 5, seal non-washable items in a plastic bag for 10 to 14 days. This is again a correct statement. If you can't wash something, like say it's like the couch or something, or like a huge animal or something, if you can suffocate the lice, that is another way that you can get rid of the lice and kill the larva and kill the lice itself. So sealing everything in a bag and sealing it for 10 to 14 days so it cuts off the oxygen supply, that is one way to kill the lice, or with hot water, or with the pediculicide, or an ointment or but a treatment source. Those are all ways to get rid of lice. So good job, guys. 2, 3, 5. Next question. The nurse is screening clients at a community health fair for skin cancer. It would be a priority to follow up if the client has what? Option 1, a pink pearly papule on the forehead. Option 2, a brownish black macule on the shoulder. Option 3, erythematous patches of, I can't say this word, telangiectasia on the cheeks. I think those are like spider-like vesicles on the cheek. And then flesh-colored plaques with a rope-like border on the ankle. Let me know what you guys think in the chat. And so sorry about my pronunciation on words. It is hard out here for a girl. I was going to say something else, but hard out here for a girl. Someone asked, why did 10 to 14 days? This ensures that you suffocate the oxygen from those head lice for a considerable amount of time. So just a week isn't long enough because sometimes they can lie dormant. So 10 to 14 days is usually long enough to truly, truly take their oxygen supply away. Let me know what you guys think in the chat. I'm seeing pretty unanimous with option number 2, which you guys are completely right. Option 2, a brownish black macule on the shoulder. So for skin cancer or screening for skin cancer, we like to use the acronym ABCDE. A stands for asymmetry, B, border irregularity, C, color changes and variation. So in this case, the brownish black macule on the shoulder. Excuse me. Option 3, or not option 3, letter D, diameter. So if it's 6 millimeters or larger, or acronym E is evolving. So if it changes size or changes shape or changes color, those are all the criteria that we look for when looking and staging and screening for skin cancer. So this brownish black macule on the shoulder is eyeing towards skin cancer. Option 1, a pink pearly papule on the forehead. This could technically be a type of skin cancer. It's a benign basal cell carcinoma that it could be, but it's actually not likely to metastasize. So the priority would be to get to this brownish black macule on the shoulder, since this pink pearly papule on the forehead is a slower growing one. We would go to option 2 first. So sometimes with priority questions, it can be a little tricky because 2 options could technically be right, but you have to choose the most right answer. That's the hardest thing about the NCLEX. Option 3, erythematous patches with the long word on the cheeks with the spider veins on the cheeks. This is keen towards rosacea. Not a priority, something that they can be managed and treated in a longer term, but not needing immediate intervention. And then option 4, flesh-colored plaques with rope-like border on the ankle. This could be keen towards eczema, which often does happen, increases. And eczema is a chronic condition that can flare up and improve with time, but it's not an immediate intervention or needing immediate intervention at this time compared to a brownish black macule on the shoulder. But you guys did good. Oh, someone was asking if I can repeat A, B, C, D, E. That is A for asymmetry, B for border irregularity, C for color changes and variation, D for diameter of 6 millimeters or larger, and then E for evolving. Okay, the next question. The nurse has attended a staff education program about pressure injuries. Which of the following should the nurse recognize as a risk factor for the development of pressure injuries? Select all that apply. Option 1, percutaneous endoscopic gastrostomy tube. Option 2, head of the bed maintained at 30 degrees. Option 3, urinary and bowel incontinence. Option 4, history of diabetes mellitus, or option 5, high protein diet. Select all that applies to more than one correct answer. So let me know what you guys think in the chat. Someone was asking where can we find these videos. You could always find them posted on our page on whichever social media page that you go on, but you could also always find it on YouTube, whether you search the specific topic that you want to look for specifically. So any of your favorite social media platforms or YouTube might be the easiest. I'm seeing lots of 3s and 4s. I'll give you all guys a couple more seconds in the chat as you recognize risk factors for pressure injuries. Let me know, let me know. Someone's adding some 2s in there. So risk factors, meaning if this is done, it would increase their chance of developing a pressure injury. Let's see, some people are still saying 2s, 3s, and 4s, 3, 4s, and 5s. We're looking for risk factors for if this is done, you will get a pressure injury. This would be options 1, 3, and 4. So these are things that risk factors increasing the chances of getting a pressure injury. You have to read the questions very carefully. That would increase the chance of developing a pressure injury. Options 1, percutaneous endoscopic gastrostomy tube. That's just a PEG tube. So if you have any extra tubes or linings that are coming out from the client's body or are touching the body, these things like maybe the bumper or just having a foreign object laying on their skin for a considerable amount of time can irritate the skin and increase the chance of developing a pressure injury. So option 1 is correct. Option 3, urinary and bowel incontinence. This is true. If you have a lot of moisture from urine or from a bowel movement, this increases that skin breakdown, the chance of you having skin breakdown and increasing your chance for developing a pressure injury. And then option 4, history of diabetes mellitus. Again, this is a chronic condition, but sometimes with these conditions, they can develop neuropathy. So sometimes their sensation and their feeling is a little bit off. So they can't feel if they have a wound or if they've stepped on something, and they just have poor wound healing in general and neuropathy. So that would increase their chance of developing a pressure injury. Options 2 and 5 are things that we would want to do to decrease the chance of having a pressure injury. So if we maintain the head of the bed at 30 degrees, like I said with the other question, between 30 and 45 degrees is our sweet spot, this would decrease the chance of them having a pressure injury. And then option 5, high protein diet. This promotes wound healing and skin healing in general. So if they have a high protein diet, this is a good thing, and it would decrease their chance of pressure injuries. But we're looking for things that would increase the risk factors for a pressure injury. So read it very, very carefully. Last question of the day. The nurse is talking with a client with acne vulgaris who has a new prescription of isotretinoin. Which of the following statements by the client would require follow-up? Option 1, I will discontinue my oral contraceptive medications this week. Option 2, I will notify my healthcare provider if I notice changes in my mood. Option 3, I should avoid drinking alcoholic beverages while taking this medication. Or option 4, I should wear a hat and long sleeve clothing while spending time outdoors. So which of the following statements by the client would require follow-up? Meaning we don't want this to happen. Also, since it's the last question of the day, let's get the chat going one more time. Drop in the chat what school you're going, what nursing school you're attending, what school you graduated from, your alma mater or whatever. Let's do one more fast through the chat as I speak really fast with y'all school. Give you guys a shout out. Get the chat going one last time. And we'll go from there. Someone just graduated from Emory. Congratulations. That's a good college. They're all good colleges, but I actually really like that college in Atlanta, Georgia. Valley View University in Ghana, Galen College of Nursing, Honduras College of Nursing, MGH, Institute of Health Professions, Valpo, Chamberlain, Nightingale, I can't pronounce this, Rasmussen University, Chico State, California, Nepal, University of Bolton, Nursing College in Kenya, South College, Middle Georgia State, West Coast University, Cali Medical Nursing College, hello from NCNA, University of Derby, Toronto, Canada, and Durham College. Graduated 10 years ago in Brazil. That's good for you as well. Helene College, UTA of Arlington, Texas. That's my alma mater. Shout out to you guys. Kenya. Hello from Cuba, Egypt, University of Zambia. Lots of cool colleges, lots of cool cohorts. Make sure you get your nursing students, your friends, everyone watching so we can have multiple of you guys watching at the same time. And also, shameless plug, always visit us at uworldnursing.com and you can book a CLEXpert and have us give a private lecture to you and your cohort as well. But correct answer for the last question of the day will be option 1. I will continue my oral contraceptive medications, or will discontinue my oral contraceptive medications this week. So we know that isotretinoin is a absolute contraindication for clients who are pregnant. This is a teratogenic medication for clients that are pregnant. So if they discontinue the oral contraceptives and become pregnant, then this can cause harm to the fetus. So we do not want them to get pregnant while they're on this medication. So they need to continue their oral contraceptives. Options 2, 3, and 4 are all correct teaching points when being prescribed isotretinoin. They should notify their healthcare provider if they notice any changes in their mood, because this medication can have them go into depression and maybe have them have suicidal ideation. So you want to closely monitor their mood and their mental health. Option 3, I should avoid drinking alcoholic beverages while taking this medication. Again, this is true. Consuming alcohol with isotretinoin actually increases the risk for liver damage because they're both metabolized by the liver, but then it also can exacerbate some of the side effects with isotretinoin. So you don't want to mix those two together. And then option 4, I should wear a hat and long sleeve clothing while spending time outdoors. Again, a correct statement. This isotretinoin medication can make your skin very, very sensitive. So you want to protect it from all costs. And it's just good practice to protect your skin in general with a hat and long sleeve clothing while spending time outdoors. So good teaching in general. But you guys did so good today. Let me know in the chat how many questions out of 8 you guys got right today. Today was a little bit tricky with the wording, but Practice makes progress, and we're going to get better each time. We go live several times a day, multiple times a week, so there's plenty of chances for you to come back and get more practice with these NCLEX style questions. To view our event calendar and seeing what topics we might be going over in the next couple weeks, cough, cough, tomorrow we go live at 11 a.m. and 3 p.m. Central Time. Visit us at uworldnursing.com to see our full event schedule. Also, you can book your Klexberg. You can get question of the day, question of the week. Lots of fun resources for you to stay in the NCLEX know. So until further ado, I will see you guys tomorrow.